right, welcome to the first episode of the podcast brought to you by the Sylvia Brafman Mental Health Center. I am Jamie Blaustein, your host, and I'm honored to be here with two mentors of mine and colleagues these days, Ben Brafman and Peter Marinelli. How are you guys doing today?
Wonderful.
Doing pretty good, Jamie.
Awesome. Glad you guys are here, and really, really excited that we have the opportunity to kick this thing off and, in my view, bring together I couldn't pick anyone better to chime in on some of these important issues from these two perspectives than the two of you. Ben, you being the clinical expert, sort of a mogul in mental health treatment.
I think that's a first. I've never been called a mogul.
Yeah, I mean, I know you call yourself, because you want to remain humble, a so-called expert.
Right,
So the
so-called
qualifier
expert.
so-called helps.
Right.
But of course, the chief clinical officer of the Sylvia Brafman Mental Health Center, and Peter, you being somebody that and I'll set some context in a minute, but when I had 30 days sober, this was about 9 years ago, living in my Oxford house, halfway house with a bunch of guys up in New Jersey, and just sort of like praying that I would be able to get it this time, listening to your talks on the internet on integrating spiritual principles into life. How do we live now that, the crutch of alcohol and drugs are not there for us? So, your mentorship and guidance on the spiritual life is something that I couldn't pick anybody better to speak on some of these topics from that angle. So,
Thank you.
So I just want to set some context here. The genesis of all this, it's just, it's God driven, of course, just like everything is. But in this case in particular, I never thought that we would be in the same room together, let alone doing, an ongoing podcast, because, and I'm, just for some additional context, I'm the CEO of the Sylvia Brafman Mental Health Center. Never thought 9+ years ago I'd be able to say I was the CEO of anything. But when I was 21 years old, Ben, I was sent to your drug rehab down here in Fort Lauderdale. Prior to that, really good kid in New Jersey, no major issues at all, got into a good college, and that started my 7-year nightmare in active addiction. And I remember my 4th rehab. I was a senior at the University of Michigan, and I was sent to Destination Hope. Mm-hmm. You were the CEO, the chief clinical officer, kind of everything at that point.
I'm on floors too.
Yeah.
The whole thing.
Didn't you have guys, weren't you doing some tech work at one point?
Absolutely.
Yes.
So overnight, whatever, driving the van,
Yeah,
absolutely.
Yeah. Nice. And I remember I was there, and you actually kicked me out. And that's because of nothing other than my own actions. I was not ready to wave the white flag on my addiction, right. To surrender. And so I kind of thought that was the last time I was ever going to see you. But of course, time went on, took another couple of years for me, I think 7 rehabs in total. And then we reconnected when I would visit Florida. I would come down and offer to speak to the patients. And obviously 1.5 years ago, we got together and we talked about doing something that was primary mental health. And here we are, kind of the best of both worlds for us.
Absolutely. And, a couple of things stand out. First of all, I could tell over the years since you left Destination Hope that you were really serious about your life and also setting your goals and staying sober. Like that was evident. And so, to go and come into DH and want to talk to the patients with no motive other than to share your hope, strength, and experience is very impressive. And then I also stayed in touch with your mom for a long time. So that was that always meant a lot to me.
And that actually, believe it or not, was probably a driving factor for how we got here. I eventually got sober and jumped into the recovery process, went to Duke, got my MBA, went to Wall Street. So when I told my mom that I was thinking about opening up a center, of course, she was like, don't do that. You have a great job. I like that you're close to me in New York. But then I told her who it was with, and she changed her tune a little bit. And she said, I support that because of those emails and that interaction back and forth. And that's why the family program at Sylvia Brafman is so, we call it the crown jewel. It's so critical. And so when when we started, I felt like we are doing great work for those that have anxiety, depression, bipolar, all sorts of things, in addition to substance abuse. But I felt like something was missing. And the reason I felt that way is because my experience is that spiritual principles and spirituality and finding a power greater than myself, not only finding it, but connecting with it and relying on it, that was the game changer for me. That's what moved the needle. And different people need different things. And so I felt like, hey, we are really good at the clinical perspective, the medical perspective, the psychiatric perspective, but I really want to feel good about taking someone with substance use disorder that's truly the real deal addict alcoholic. And it just so happens that around that time I got reconnected with Peter. We had known each other through Ian, and we had connected at some conferences.
Many years.
Yeah. Mm-hmm. But I was like, I really want to work with this guy in my personal life as a mentor. Right. And so we started that way. And then what came about is, maybe Peter and what he's doing, which is this amazing spiritual immersion program that Through the Archway, could join our team. And then we could finally bring that strong dose of soul and spirituality specifically to those that need that nuance in their overall wellness program. And so, here we are. And it's just, I have a hard time really believing this is reality, but here we are. And so we're going to dig into some of these different topics.
Let's do it.
And I really appreciate that your perspectives, there's a lot of overlap. There's some distinction as well. And I just want to showcase that to the world because both of these perspectives were so instrumental in helping me get better.
Stuff.
So today we're talking about the stigma, right? The stigma of addiction, the stigma of mental illness. And let me just throw it out there. Like, what is your perception of what the stigma is right now? And do you see a difference with respect to mental illness and addiction?
My experience has been a terrible stigma to it. I grew up with a parent who had mental health and addiction issues, and it had to be kept a secret, what the neighbors might think. And folks began to know, and they looked upon my mom as weak and cowardly and not doing a job as a wife and a mother, and just awful. It may have lessened a bit. I have another family member who's going through it right now. In fact, Ben and I had spoken over Thanksgiving holiday. I had a brother who was in crisis, serious crisis with mental health, severe depression and anxiety stuff. And there were other folks at the dinner table. We had to keep it a secret because we knew they wouldn't react favorably to it or supportive of it. They would just like get it together, that kind of thing, or didn't want to deal with it, tuck it in the closet somewhere. So my experience has been it's still there. My experience is also that I know enough about it to embrace folks who are hurting like that and put them in front of the right people. Someone has to do a job like that. So here we are. And as far as, it's interesting how Ben comes from one school and I come from another and you come from a little bit of both. God has an interesting way of rearranging stuff and put it together and making it gel really nicely, smoothly. And so Ben had a great analogy yesterday. Everyone comes together with a specialty. And when that gels, you have a really good operating machine to help folks who are going to be shunned by many. My job is to take a peek at what I'm doing and try to make difference. Like one life gets changed, it's a success, because that saved life has a ripple effect. They will have an impact, positive impact on family members, which will have an impact on other people. So the whole complexion, the whole climate of the family changes. Yeah, I know the downside of that. My mom committed suicide. Depression was so bad, and I know the impact of that. It leveled us for years. Being in this business with addicts, alcoholics, mental health sufferers, I've seen a lot of heartbreak, but I've seen many, many successes and the impact that has. It's the thing that makes me get up and go to work in the morning.
Peter, can I ask you a question? I don't know if this is too personal, but when, and I've heard you talk about your mother, did the family ask you to not tell anybody the reason?
Well, it's interesting. Yes. The short answer is
stigma.
Don't say anything.
Yeah.
And so as a kid, I was 14 years old, and I was going to school and saying my mom died of cancer. Because in that 14-year-old mind, I thought that would work with others. They'd get that rather than, oh my God, suicide. Why suicide? Well, she was so depressed for so long. I remember the last month of my mom's life, I think she got out of bed once or twice. And so my dad, in his best effort, said, just let's not talk about it. Now, we did not, as a family, discuss the details of what happened till I was in my mid-30s, where I had a brother sit down and says, we're calling a meeting with Dad and our other brother. We're going to flesh this out. We need to talk about this. And it's unbelievable how much pain my dad was in. It was as if he was giving us the news of Mom's passing for the first time. And then we found out. And we got to talk about I think it's called a toxicology report, as how much drugs she had in her. But it began to get into the light and began to heal. And that was the beginning of healing into my 30s, because it was a secret. No one, and I literally mean no one in the family, discussed this. So it wasn't going outside.
The stigma, that we're talking about, it's been a driving force. It's been a driving force where society as a whole hasn't really accepted the drug addict, alcoholic, or the mentally ill. The stigma will tell people that a drug addict is, under a bridge, pushing a shopping cart, homeless, all of that. And we know that it's park bench to park place. And then with mental illness, people generally speaking, don't discuss it. They don't understand it. Mostly because with mental illness, there's a lack of faith. And with faith, you have to believe in something that perhaps you can't see. And so what Peter is talking about, and he right on point, is that shame takes over a family system. Shame takes over the group. People don't want to talk about what they really need to talk about. And in terms of addiction and mental illness, to me, and this is my perspective, and it's one of the driving forces of SB. But from my perspective, everything is under the domain, the umbrella of behavioral health. Addiction, substance dependency, substance abuse, substance use, depression, anxiety, schizophrenia, bipolar. It's all on a continuum. It's just a matter of, okay, what do we implement? How do we triage this? And so for somebody who identifies as an addict, it may be the 12 steps. It may be, meetings. It may mean sponsorship. That's their medicine. Group therapy, individual therapy. For the mentally ill, it might be medication, because of no fault of their own, that their brain is not producing certain chemicals. So this separation, which I ran into as soon as I got into the field, it becomes prejudicial, territorial, and frankly, it's financially motivated. To separate the addicts and the mentally ill, funding and all of that. to me, it's all under the same umbrella. It's just a matter of what interventions we're going to use.
Yeah. So a couple reactions. Like first, you talked about everything being on the same spectrum, right? Like that. I get that now. I had a hard time wrapping my mind around, like I said, for me, spirituality moved the needle. That was the big thing, right? If I have to quantify it, because I'm a former banker, so I'm going to, 90% was that. Maybe 5% was medical and 5% was clinical, right? That was my wellness package. It didn't occur to me that for somebody else, maybe it's 30, 30, 30, 10, or maybe it's 45, 45, 10, or maybe it's 20, 20, 20, right? So I think we do a really good job of figuring out like what is that ultimate combination. I can't relate to somebody personally who it's 80% clinical, right? Talk therapy,
right?
Like that.
Right.
For me, I needed.
Could I interrupt you for a second? Because you brought up a great point. I don't think you're that much different than Joe Smith down the street. I think that people need to wrap their head around this whole continuum thing. And if you remember when we talked about it, initially you're like, I don't get it, or I can't pin it down. But the very fact that you dug a little bit deeper and you parked it correctly for yourself, you did a lot of inner work. Because we're sitting here now, right? Most people don't do that, so they reject it.
Sure.
And they lose out on everything. But that's what I'm talking about, is that, and you remember my reaction to you was like, whatever works, whatever makes you come to the table, then do it. I'm not going to argue over percentages. Certainly not with the banker.
And I think there's a semantics thing, and I'm going to you right now, Peter, because, and we're going to talk about trauma, I think, later in a different episode. Mm-hmm. But like, I view, my spiritual principles through the steps, that actually did a lot of the trauma work, did a lot of the, putting pen to paper. A psychologist might have approached it differently to get at the same thing. It was just that the mechanics of that process.
I have found my experience, there has to be a sense of desperation from the quote unquote client or the addict or the alcoholic, whoever we're speaking to. There has to be some sense of desperation where the desperation, even briefly, is screaming louder than the ego. That makes that person reasonable to be able to teach. And then we have to have an environment, a safe environment, whether we're taking a spiritual principle, clinical principle approach, I should say, or both, where that person, that group, feels free enough to share their brokenness with others, because others will get it. It's a shared brokenness. Once that begins to take place, a safe environment like that, and we start to get at the quote-unquote problem, then we can begin to work on what is the solution to this. We need to readjust your medication. Sure. You need this type of trauma therapy. You need spiritual approach and maybe some clinical.
Sure.
But we have an environment that we created, this quiet little mess where folks come in and say, this is how I feel today. I don't feel anything today. And 3 or 4 other people say, me too.
Yeah.
And we have someone facilitating this who gets all of that. Mm-hmm. Now, I will tell you my experience. We talked about this yesterday. I've gotten frustrated. I've run out of patience. And I know family members who don't have the education run out of patience and get frustrated quickly. Then they blame facilitators. They blame the family member. They're not getting it quick enough. So it's vital that someone, my experience has shown, is put in a good, safe place to get some traction. Because once they get out there, the world out there, I know it sounds terrible, but really doesn't care about your mental health issues. It's moving really fast. It's volatile. It's unfair. These folks need to have their legs under them. I don't care what approach they're taking, whether it's medication, clinical, spiritual, all 3 combined. They need to get some traction in order to make it out there, because they'll just revisit treatment center after treatment center, and eventually take their own life, make the supreme sacrifice. And we don't want to get that kind of phone call. So for me, doing work like this, it's There's something, when I was a kid, I remember growing up, I said, I need to help people. I thought a doctor was the way to go. But as I get old, I realized this field is where I got called into, and it's very satisfying for me. Maybe I can make a difference.
Mm-hmm. I want to hone in on just going back to the stigma real quick. So it's funny because sometimes folks will get a call from a family and they'll say, my son or daughter or whomever is mentally ill. We want them to come to your facility, but we don't want them with the addicts. And then we'll have somebody call.
Vice versa.
Right,
yeah,
exactly.
absolutely.
And say, we don't want them with the mentally ill. They're an addict, right? So it's funny. That is representative of that there are two different stigmas. Different people subscribe to different ones. If you asked me at the time when I was sick and suffering, I would have probably said, I don't want anything to do with the mentally ill. I just liked, you know what I'm saying? But I get it. And so it does kind of represent that, okay, the stigma's alive and well. They're different. And I just want to throw this question out there. Like, why do you think that the stigma associated with addiction, mental illness, behavioral health, why do you think that differs from the stigma associated with a physical problem, right? In reality, like inherently, they're the same thing, right? It just means that you have a condition that deviates from the norm. But no one's afraid to say, hey, I got a broken arm. They're viewed completely differently. There's probably most people that wouldn't volunteer, I have depression. So like what drives that? Like what's the difference there?
So there's a couple of things that drive that. So the first thing is that generally speaking, people need to see something to believe it. They need to see it, they need to feel it, they need to taste it. And a lot of times you don't particularly see it. You don't understand it. You don't see what's going on in somebody's brain, whether they're an addict or identify as an addict or identify as mentally ill. That's one thing. So right there, people will jump in and fill in the blanks as to why that person is the way they are. They're lazy. They're stupid. They're a sociopath. They just don't care. They don't care enough. They're abusive. They're narcissistic. I mean, all that stuff. The second thing is there's a counterintuitive approach to all of this that makes people it kind of carries the stigma. Counterintuitive is that a great example is AA meetings. You go to an AA meeting and there's no rules, there's suggestions. So you're telling me you're gonna put a bunch of alcoholics and addicts in a room, and they're actually gonna sit there for an hour, and they're gonna listen, and they're gonna participate. And you say yes, of course. And you go, no, they won't. They don't listen to do anything. And yet the meeting happens, and a lot of really good things come out of the meeting, and they do stay. It's counterintuitive. It's kind of like, and then you're asking family members to almost do the opposite of what's in their DNA. Child falls on the ground, scrapes their knee. The parent reaction is, I'm going to pick up my child and I'm going to attend to their wound. In this way, we're asking people to almost do the opposite. Let them fall. I'm not talking about a child, right? Let them fall, let them feel the natural consequence, and then you go from there. That's the other thing that drives this stigma, that people don't quite get that, and they fill in the blanks. Oh, he's pretending. Oh, he's this. Oh, he's that. So that's that's the other thing that drives it. And the third thing, and there's more, but I'll stop at the third thing. The third thing is the stereotypes that are out there. That drives the stigma of all this. When we think of mentally ill, I've been in the field for over 25 years. When I think of mental illness, first thing that pops into my head is One Flew Over the Cuckoo's Nest, right? Great movie, great depiction of mental illness and all that stuff. But also this Hollywood, right? This is Hollywood. And it's not 100% like that. With the addict, I think it was that movie with Ewan McGregor, Train Spotting. He was a heroin, and I remember the scene where he sticks his head in the toilet, this whole thing. So you think of those things, and you look at, drugstore cowboy, robbing, doing all these things. And some of it's true, some of it's not, but we're sort of pushed in that direction. And we lose out on the minutia of things. I was talking to Peter yesterday about this, that we come in, a lot of times facilitators come in and they have these, and therapists, they have these tremendous treatment plans. They're going to accomplish, they're going to get to step 3, or they're going to identify 10 coping skills. And, they're going to talk to their mother and father, and set boundaries and all this stuff. And I'm sitting there going, can they make their bed? Can they brush their teeth? Mm-hmm. That's where that's at. And so if we really hone in on what a person actually needs, we can shatter the stigma, and certainly the stereotypes. But I don't think we're going to be able to. I think that we can get close. We can do things like this. We can have treatment like we do, but it's a powerful foe to go up against, public opinion, politics, all of that stuff. So we just need to keep doing what we're doing in the southeast corner of the United States.
There's a lack of education and awareness and fear. If I see someone who's in a wheelchair, whether they have a broken leg or something has happened to them, I can get that. I understand that. But when I see someone who's not getting out of bed, who's unkempt, who you ask a question and they're answering with something that has nothing to do with the question, they kind of have that glazed over look, or they're loud and obnoxious, I don't understand what's going on with them. So I want to push them away. I can't grasp this. There's fear involved. They're scaring me. They're not doing what I want them to do. Get out of bed, damn it. Get a job, and they can't. But if I understood what's going on with them, this is why they are the way they are. And they need to go into a place that can get them out of that. So a lot of it is just a lack of education and awareness. I don't understand this. What I don't like, I fear. What I fear, I despise.
Mm-hmm. I wanted to mention one other thing. The other thing that drives the stigma is the medical model. The medical model in its simplest form is, let's cut the cancer out, operate, cut it out, sew it back up. And when you're dealing with mental illness and you're dealing with the disease of addiction, okay, but that's not going to work consistently across the board. There has to be a systemic approach weaved in with a medical model. I'm all for isolating the disease, so to speak, and then honing in on it through group therapy, medication, AA, NA, whatever it takes. But the medical model is a massive driving force, especially in the West. It's because it's big money, but it's not effective the way that it would be if you combine other therapies such as systemic thought and mentioning what you said, really challenging the belief system of the individual and the family, and so teaching them different coping mechanisms.
Yeah, what you're talking about in terms of the misunderstanding, I kind of weed out of that the core issue that's misunderstood is power of choice. Like, why can't you get out of bed? Why can't you just? You're assuming that it's a choice, and just as we know with addiction and substance abuse, right? There is a lack of power. With regard to the stigma, I remember I got sober, and I'm like 6 months in. I'm starting to feel a lot better, and I can date now, and I think I could. I was doing the deal, and I went in. I lived in Hoboken, New Jersey at the time, and I went into New York, and where do people at 24 years old go on a date? Typically, it's for a bite and drinks. I felt at that point the obsession was lifted and I felt comfortable with that. But when I got there, I started to let the stigma creep into my mind. I got very self-conscious about the fact that I wasn't drinking. So I get to the bar early I asked for a club soda with lime in a cocktail glass because I didn't want to convey to this person that I wasn't drinking. So it's funny looking back on it. I tried to play off that date, without mentioning it, like as if, oh, yeah, you're having a drink, I'm having a drink. I just got here before you, so I got my drink first, right?
Right.
Over time, that shifted to, okay, I know my truth. I have some self-esteem now. I'm actually comfortable in my own skin and I can own it. And what I would like to see is that the stigma is flipped from this is some sort of moral deficiency or lack of, whatever, some sort of insufficiency to, no, it just is a thing, just like a broken arm, just like something else. And those that have climbed out of it have an awareness and some intangible qualities, especially those that can go out and be used to go help people that are actually beneficial. So it's kind of flipped as a positive thing. We have a couple minutes left. I just want to hit on how do you guys approach somebody who the stigma is preventing them from doing what they need to do to get better?
Truth. Can't lie to someone. Lovingly. Direct, but lovingly. Give them truth. This is what I observe. This is what I see. This is what I know. This is what my experience tells me. The challenge is so many of us have this delusion that life is controllable and we can control it. So if I tell someone, depending on how they're looking at it, good news or bad news, I have a false, unrealistic expectation that they're going to say, okay, great, what do I do? Most cases, they're not even going to listen because they're not there yet. But for me, it's just giving someone the truth over and over and over again. I need to be consistent with that, lovingly give them the truth.
Level of acceptance. I like to, when I am with somebody that is, as you described, I need to find out where their level of acceptance is and start there. Because I can start there, then I can move forward. And it may take a while. And if you weave in what Peter is talking about, which is, repeating the truth and being consistent and having structure and all that's where you go with it. But it's levels of acceptance.
Ben, you alluded to that there's some progress that's been made, but I'm not going to call it a cynical view. It's maybe a realistic view that we might never get there to the point where it's completely eradicated. In the last couple of years, especially during COVID, as a major a headwind to mental health, but a tailwind to speaking about mental health, right? You've seen Michael Phelps and Simone Biles and all these people vocalize it. There is, just from a layman's perspective, not a behavioral health person, like I can see that it's being talked about. I think with Instagram and social media, people are, sharing stuff more. I guess the final question for today is, what do you think the average person in society can do to kind of keep that wave going? And, what can we as individuals do to combat that stigma?
So first off, the individuals need to just educate themselves. There's a ton of resources now, and just getting on a computer, but they need to educate themselves. And the other side of that is, as professionals in the field, we need to continue to send the message to all the social media outlets, and to what's there. And then, and this is probably not going to happen, but we need to make service available to more people. That's a huge problem, just in the United States, that there are states that just, they have services, but, good luck finding them. Even here in South Florida, Broward County has a lot of resources, but it's like the worst kept secret in the world. So there has to be this come to Jesus moment where we push everything into the middle of the table and say, here, this is what we have. This is what what we can offer you. But we're not doing that right now.
You know, I hear a lot of optimism, and you know, I'm excited to see where this goes and how the stigma evolves over time. I know that we're all doing good work, and I hope that we're part of the solution. I think that we are, and I think you know, hopefully over time, people in society get to see some truth about what it really means to have an addiction or a mental illness. So I thank you guys so much for all your contributions for today, and I'm looking forward to next week where we're going to talk about how you convince a loved one to accept help. Hope you guys have a great week.
Thanks, Jamie.